Good afternoon. Selamat siang.
Good afternoon, doctor. So maybe as introduction for all of us here, could you please introduce yourself first?
All right. So my full name is Ray Oronan. Okay. I came from the Philippines. I am an assistant professor from the University of the Philippines College of Veterinary Medicine. What else? I have been the veterinary teaching hospital director of the VTH of CBM from 2018 to 2019. And I was also the faculty in charge of the veterinary teaching hospital Diliman Station from 2010 to 2014 and 2016 to 2022. Aside from that, aside from teaching and doing clinical duties at the hospital, I also have friends and we put up a veterinary practice, a private veterinary practice in the Philippines.
Okay, so already a lot of experiences, yeah, it sounds like that. So, so I think because the theme is about common cases that happen in Philippines, maybe we all would like to know, like, is there a common infectious disease that happen in Philippines based on your experience?
Um, well, the most common condition that we see in the Philippines, especially in the veterinary teaching hospital, would be skin condition. And if we still divide them down into the different skin conditions, the most common skin infection we see is dermatophytosis, fungal infections. The second would be parasitic infections, so skin parasitic infections such as mites, scabies, demodicosis, and then the third one would be bacterial infections of the skin. Now, if we are talking about zoonotic, zoonotic infections, as of now, there is a rise of leptospirosis cases in the Philippines because of the monsoon. So there's a lot of flooding right now, and since there's a lot of rats, I guess, so the leptospirosis is also increasing.
Okay, so I see. It's quite actually quite similar here, I think, in Indonesia. I think due to our closeness of area, yeah. So that's about common infectious disease. As you said, the first common one is skin disease, right? So how can like pet owners, do you think, protect their pets from that very skin disease?
Alright, so for skin infections, well, number one, dermatophytosis is usually around. It's everywhere. Usually the fungus is on the soil. So the best thing that I guess the owners would do is to keep their pets immune system strong. Basically by giving good food, vitamins, and then of course keeping them healthy. Um, for the others, like for the mites, the secondary bacterial infection is the secondary to other infections. But then for the mites, then of course they have to make sure that they don't get their dogs in contact with other dogs that may be harboring the infection.
Okay, so that's for the pet owner aspect, right? Because I think among us, most of us are veterinarian. So I think we would like to talk about the veterinarian aspect from it. So how do you easily diagnose that skin infections?
All right. So for the skin infections, usually there is an algorithm for diagnosis. So once you are presented with a patient, okay, so you get the history first, and then upon getting the history, you do your clinical examination. So you do your systematic examination. Don't just focus on the skin, you also focus on all of the systems. But aside from that, since the skin is the primary reason that they went there, then you have to do your full clinical exam. So you have to check first for grossly examine or seen parasites such as ticks, fleas, lice, like that. And then if it's negative, then you also examine microscopically. You examine for the mites, the demodicosis, for demodicosis and for scabies. If Chela can also be found, then you have to examine for that. Then also do fungal examination, so you can do your tape test or tape technique. You can also do hair plucking. Okay? You can also do the fungal culture if the owner would allow. And then what else? So from there, you'll be able to diagnose or see a lot if it's already there. And then if it's negative, then that's another story.
What happens if it's negative?
Alright, if it's negative, then you have to dig deeper. So it could be, one, could be allergies, okay? Could be atopy, could also be hormonal in nature. So you have to look into that as well.
Okay, so during the diagnosis process, I heard that you mentioned the usage of instrument for clinical pathology. Now maybe we can dive more into that because I think in INAHEX, I think most around us are clinical pathology instruments to help diagnose easier. So do you think, can you share some insight into how advanced clinical pathology device can make a positive impact and also like your experience in Philippines, maybe how was it?
Alright, so the most basic instrument or thing that you can have in your clinic for diagnosis is the microscope. So with the microscope, you can actually examine microscopically whatever that can be seen grossly or by the naked eye. So you can do your smears, you can do your fungal examination, hair pluck examination using the microscope. And then you can add that up with stains so that you can further examine more and more tissue samples. But apart from that, if you want to, let's say, examine more of the animal, okay, the immune system of the animal or the health status of the animal, then you can further examine or use your CBC machine. And then you can further down examine by using blood chemistry machines. Those are the basic machines that we can use, especially for diagnosis, for screening of the animals.
Okay, so that was the basic first one, right? There are quite a lot already, right? Microscope, CBC, blood chemistry. Okay, so that's the basic one. Let's go upgrade more. What else?
All right. So for the critical care, okay. So aside from your blood chemistry is very important, especially for screening and then for monitoring. But aside from that, if it's, for example, critical care, then you can go into electrolyte examination. You can also go to blood gas examination. What else? If you have a patient monitor, you can also do that and then check for TPR, temperature, pulse, and respiration, okay, plus the SpO2, okay, pulse oximetry. So that there will be a lot of things that you can use. But that's more on more critical care.
Okay, so I think there are quite a lot of clinical pathology instruments, right? So do you think, is there any challenge that might still need to be addressed in their implementation?
The number one challenge for us veterinarians to be able to use it and to recommend it, or for the owners to approve or give us the permission to use the machine for their pets diagnosis would be, of course, the cost. That's number one. Okay, so we have clients that when they come in, ma'am, sir, these are the tests that we can do or we recommend so that we can fully diagnose or check the clinical status of your animal. And then the next question that comes in will be, how much would it cost? Okay, and then the next thing or exchange of conversation would be, this is how much the tests would cost, and what if the owner says, oh, I only have this much. So can we choose the best or the necessary tests that we can use or we can test for now? Now, of course, that would also affect our diagnosis. Now, as a veterinarian coming in from the teaching hospital. So the teaching hospital, we give the service for it's not expensive, right? Inexpensive services. So when they go to the veterinary clinic, we know that sometimes they have limited budget as compared if they go to the private clinic. So with that, then we are forced to work around the budget. And that's the number one, let's just say, challenge for the veterinarians. Because if the veterinarian has a way of explaining it to the owner, and the owner is actually willing to pay, then you can actually do a lot of tests. That, of course, necessary only. You don't test whatever's not necessary.
Yeah, that's very important, yeah, for all of us to only test the necessary one. Okay, so maybe we can go on to our next part question. So, of course, being a veterinarian means we're not just working with animals, but we're also working with a community of people. So, how do you think in Philippines can local communities engage in promoting such as like responsible pet ownership or like the health and the welfare of pets of in general?
Actually, in the Philippines, we have several groups that are working on one educating the community. So we have the government who encourages the community to have their pets neutered and vaccinated. So the vaccination actually happens every March to May, but in some localities they do that all year round. Okay? Especially for rabies vaccination. So they encourage that the people or the owners will have their dogs vaccinated. Number two is that they also encourage the owners to have their dogs and cats neutered. And that's of course to prevent unwanted cats and dogs and to control the population. Okay? Of course, with controlled population, we also ensure that the animal's health is controlled, or let's just say they have optimum animal health. So the government, and then we also have the non-government organizations, the NGOs. They also go into the communities, and then they also perform spay-neuter activities. So I myself is a volunteer for the Palawan Animal Welfare Foundation. Okay, so we go to Palawan and we just neuter dogs, and of course the community really loves that. Okay, they are encouraged to bring their pets to the veterinarian or even to the program. So that's one way that they can engage the community.
Okay, so it's also important, yeah, to engage not just the pet owner but also the community overall. Okay, so maybe we're going to our next questions, which we are going back to the small animals, the pet again. So, based on your experience, do you have any? Can you share any story to us, maybe about specific, maybe like nutritional challenge faced by small animals in the Philippines, on your experience?
All right, so we have a lot of dog food products, okay, and then let's just say that not everyone or not all Filipinos can afford to feed their dogs and cats the commercial dog food that's available, commercial cat food that's available in the market. So the next best thing is actually you can make your own. Okay, so you can make your own balanced meal for your dog. But the usual problem that we have is that one, some of our people, of course, will only feed scraps, okay, the leftovers, which of course would not be balanced, will not have enough nutrients for the animal. And then, what else? Usually like that, more on the non-balanced food. And of course, if the animal is not receiving enough nutrients, then that will lead to various types of diseases.
What do you think the harm of like nutritional deficiency or like giving leftover food to pets? Is there more harm than benefit?
Actually, it's more harmful. Let's just say we are a rice-eating country. Okay, so we, if you only give rice, carbohydrates to the animals, and not enough protein, then of course the growth will be affected. And we know that excessive intake of carbohydrates can be stored in as fat. Okay, so we see a lot of dogs with obesity as well. Number two, if they don't receive enough proteins, then of course they won't be able to grow properly, and then their response to different diseases may also be affected.
Okay, so I feel like I'm talking to an Indonesian already because we also eat rice here. It's our main food too.
Yes, mostly Asian countries eat rice.
Yeah, that's true. Okay, so maybe for the last question, this is about the future of veterinary care. In your opinion, what do you think are the key of improvements and also development in veterinary care for small animals in the Philippines that also maybe can be implemented also in Indonesia?
All right, so Indonesia and the Philippines is similar, very similar. Okay, and I see that you have the INAHEX already, and this is the fourth year. Okay, in the Philippines we have small animal conventions as well. So we have the Philippine Animal Hospital Association, and it is already our 28th year. Okay. This year we had the PAHA conference just last week, and it's the 28th year. The PAHA started small. Okay, so we had years before that the conference would only have, let's just say, 100 to 300 to 500 participants. And then over the years, because of the efforts of the veterinarians and of course of the community, as well as the sponsors, okay, so they were able to push the veterinarians to attend, okay, for continuing education as well, okay, and now we are on the 2,000 plus participants per conference. That's one thing that INAHEX would be achieving in the next years as well. The second would be the call for specialization. So in the Philippines, we have, of course, the fresh graduates are general practitioners, and then you can also have, or you can also upgrade yourself in the practice by becoming more specialized. So say for example, if you want to specialize in surgery, then you can do that, you can train. You can also go into orthopedic procedures or orthopedic surgeries. So we have collegiate bodies in the Philippines. Say for example, the Philippine College of Canine Practitioners. So they are diplomates, they are in effect like a masteral course. Okay, if for the academic it's masteral and PhD, for the practice it's on the diplomate and the fellow. Okay, so you can go to specialization. And that's what we do in the Philippines as well. So we are actually encouraging more veterinarians there to go to specialization so that you can offer more to the clients, okay, into the veterinary industry, and more collaboration. So we have collaborations with different veterinary partners from around the region and also internationally. So I think the DNX is a start, okay, and I think there will be more collaboration in the next few years.
Okay, I think that's like a take-home message for all of us. Yeah, keep collaborating, keep developing, and keep learning, especially like special interest for a veterinarian. Okay, so maybe for last of the last, do you have any closing statements?
Thank you very much for the invitation. Okay, thank you very much for having me here. What else? I hope to come back here. This is actually my first time in Indonesia. So I hope to come back because I know that there are so many things that I can do and I can visit in your country. Okay, so thank you very much.
Okay, give an applause again for Dr. Ray. Okay, thank you very much, Doctor. I hope you have a great time here in Bogor. Thank you. Okay, so that was for the talk show of today. Again, thank you to Dr. Ray for such an amazing insights that he shared with all of us. The take home message, kembali lagi ke bahasa Indonesia, pelajaran yang diambil dari talk show hari ini yakni terus berkembang, terus berkolaborasi, dan belajar bahkan sampai ke tingkat spesialis katanya. Baik, mungkin sekian dari saya sebagai MC. Saya ucapkan terima kasih banyak untuk perhatiannya, dan juga saya izin mengumumkan untuk acara besok yang tidak kalah seru. Jadi